After about 22 years in contacts and many more years in glasses, I am ready to ditch them both. See, my contacts significantly irritate my eyes. They're dry, they burn, and for me, glasses are just kind of inconvenient. They give me headaches. So my answer, LASIK surgery. I met Dr. Carl May of May Eye Care here on Good Day PA. I very much trust him to perform my surgery. Dr. May is back today to talk about that and more about LASIK. I'm really excited to have you here.
Oh, it's good to be here. It's good to see you, Amy.
You have said before that spring and summer are like a really popular time for folks to seek out LASIK. Why is that?
That's because when the weather starts to get warmer and you're outside more, the days are getting longer, your contacts and your glasses start to become more annoying. You notice them more as you get more active. Glasses fall off, you lose a contact, you're on vacation and you lose your glasses and you may not be able to get them replaced. So people are thinking about it more at this time of year.
I would agree with that, yes. It becomes just more frustrating. And now here's the thing, there are different kinds of LASIK procedures, right? So how do folks know what's for them?
There are two major types of LASIK procedures. There's LASIK where the surface of the eye called the cornea is what we're operating on. We make a flap. The cornea is here. We take a flap right off the top. We do the laser and then we recover it.
Okay.
That's the preferred type of surgery for most patients because it's more instantaneous. You start to see right away. Usually the next day you're seeing fine. And there's very little discomfort. So that is the procedure we like to perform more frequently and the procedure that patients love. There's another procedure where we don't make the flap and we do the procedure right on top of the cornea without making a flap, so there's nothing to cover it when we're done. There's more discomfort with that and it takes much longer to heal. But some people have prescriptions that are very high or they have very thick glasses. We have to take more tissue away from the eye. There's not enough room to make a flap. So usually your doctor helps you decide which one's better for you after they evaluate your eye.
Right, and speaking of the evaluation, a few weeks ago I visited you and had all kinds of things done to my eye. So what happens during an evaluation?
We offer a free evaluation where a patient comes in like you did and we do a bunch of measurements on the eye. We do what's called an autorefraction where we measure what your prescription is. We check your glasses prescription. And then we do something called corneal topography where we're measuring the shape of that cornea, the surface of your eye.
Okay.
And that tells us if there's enough thickness to do the procedure for your prescription and also if you have any abnormal disease or problem with your cornea that would prevent us from doing it.
But then comes surgery day. Like, that's the long process, it seems for me. You know, I was there for a while, you know, getting all those tests done, but come surgery day, it's pretty fast. What happens on that day? On
surgery day, you come in, most people are excited, they're anxious, they're a little nervous, they have butterflies.
All of that.
That's normal. We take you back into the procedure suite. We get you comfortable on the surgery table. And it takes about 5 minutes for each eye. There's not really any pain. We sit you up, and when you sit up, it's foggy, blurry, sort of like you're swimming underwater, like your eyes are open underwater. And it stays like that for a few hours. Usually that evening or the next morning, your vision starts to get really clear.
I'm gonna love this.
Yeah.
Let's put your contact information up on the screen. Quickly, just if somebody's interested, just give you a call.
Yeah, either visit our website to get our information or give our office a call and we'll get you in for a free evaluation.
Okay, I put my stamp of approval on it. And well, you're gonna come back and we're gonna let everybody know how it went, which I know is gonna be fabulous. So we look forward to having you back and I'll see you in a few weeks.